Hello, my name is Emily. I'm a nurse navigator here at the hospital. Today we're going to be going over shoulder replacement preparation and recovery. Some good phone resources for you to have. To contact myself, you can call 406-579-2799. It is a work cell phone, so there's a text option and also a voicemail. I have it on me in the office Monday through Friday and as needed on the evenings and weekends as I take it home with me. If you want an all-encompassing good number, like a phone tree option, just everything's all in one place, then you can call 406-414-5094. Number one will get you to me, to my phone. There's another option for pre-anesthesia clinic if you have questions about meds or labs, and then another option for your surgeon's office. If after surgery you're having issues after business hours, in the middle of the night, or on the weekend, there are two options for you to call an on-call orthopedic surgeon. The first would be our switchboard here at the hospital, 406-414-5000, or you can call your surgeon's office and the answering service will connect you to an orthopedic surgeon. Preparing for surgery, we want you to start doing deep breathing exercises. This will help ward off any lung issues like pneumonia after surgery. We want you to start opening those lower lobes instead of kind of doing shallow breathing. So we want you to start taking big, big, deep breaths where you feel those lower lobes opening up in through your nose, hold it for a few seconds, and then let it out real slow through your mouth. So hold it, let it out real slow. Start doing those whenever you think about it. Maybe you're in the car and you're at a stoplight or a stop sign, you're in the shower, a commercial comes on TV. Try to do a few an hour while you're awake. After surgery, we'll have you continue doing deep breathing exercises. We also ask that you stop smoking as soon as possible and then not start again smoking for at least 2 months after surgery. This does help decrease your chances of any lung or heart issues. It decreases your chances of a surgical site infection, and it also decreases your chances of any delayed healing of that incision area. Oral care is pretty rare, but we like to mention it. You could get an infection in your mouth that travels to your new shoulder hardware. So if you have anything going on with your teeth, you might want to go to the dentist and just get a surgical clearance. If there's any procedures or surgery that needs to be done, kind of major dental work, then you do need to call your surgeon's office as you may need to reschedule your shoulder surgery in order to treat your mouth first. So that infection doesn't go to your new shoulder. Home setup, clear paths, just hallways that don't have any cords running across, any major walkways, don't have any rugs that slip around. Maybe the edges of the rugs are curved up, or you have the big thick shag rugs in the bathroom. All of those items are ways that you may trip and dislocate your new shoulder, and so we ask that you put all those away. Also prep as much as you can. So for after surgery, you'll be able just to go home and relax. So we ask that you do some laundry so you have clean clothes, get some groceries, maybe freeze some meals, put some lights, night lights in your bedroom if you get up to go to the bathroom, and then set up care for your pets so that you're not trying to walk a big dog or squat down to clean a litter box. Designating help for after surgery, we do ask that everyone has a personal coach. It's kind of a name that we gave it, but it can be anyone you feel comfortable with. So it could be a spouse, it could be a child, a family member, a friend, a neighbor. Doesn't matter who it is as long as you feel comfortable asking them for help. We don't want you to try and be super independent and stubborn after surgery and then something happens. So try to have someone that you feel comfortable with that you can ask for help. They may serve as your primary assistant at home. Maybe they'll stay with you. Maybe they'll just be checking in on you quite often. Maybe they'll provide meals or rides or go grocery shopping for you or clean your house a little bit. But we do ask everyone has someone they feel could be a personal coach. You also need a sock buddy, which could also be your personal coach, but you will need help putting on those compression stockings after surgery that you see on the screen. They're very, very tight. No way you can get them on with one hand. They're hard to even get them on with two hands. So you are going to be wearing those just to circulate your blood a little more, maybe help with some swelling that you might get in your foot and ankle from all the fluids you receive here in the hospital. We'll going to put them on you after surgery. You'll go home with them. So don't go buy any, but then you're going to wear them for about 2 weeks. Once you're really up and moving, you can quit wearing them. So they are good motivation to get up and moving. We say just air dry them, or excuse me, hand wash them and then air dry them. You can take them off at night if it's hindering your sleep, but then make sure just to put them back on in the morning. Driving precautions, you're going to see the doctor at a follow-up 10 to 14 days post-op. At that point, they'll clear you to drive. Kind of depends on which arm you're having done and what kind of car you drive, but usually by that 2-week mark, you're ready to drive. We ask that you never drive on narcotics as it's not safe. And then if you want a handicap parking permit, you can get that started at your surgeon's office. You can call in with your driver's license card number. They will fill out a form, the doctor signs it, and then it's faxed to DMV. DMV will then mail it to your house. It can take 1 to 2 weeks. If it's around the holidays, it may take longer, so kind of think about that ahead of time. Outpatient physical therapy. So this is a good one to get set up ahead of time as well. You're going to go home usually for that first couple weeks and just heal and relax, and then you'll start outpatient physical therapy when the doctor clears you. You pick a place that's convenient for you, the doctor sends over orders, and then you can get on their calendar schedule. Some other options besides that outpatient physical therapy are home care services or a skilled nursing facility. With home care services, they do go through your insurance. This would be some professionals coming into your home 3 days a week for about an hour. It would be a nurse at first to do an assessment to kind of see what you might need. They can look at your incision, make sure it looks clean and dry. They can do some vital signs, review your medications so you're not confused by any of them. And then an occupational therapist would come in and do some shoulder exercises, help with activities of daily living, such as showering. And then a physical therapist could also come in, just do a safety evaluation of your home and kind of do some exercises and walking. The other option would be skilled nursing facility. So this is usually for people who live alone. Maybe this is your dominant hand having surgery on, and then you just, I don't know, we just don't feel like you might be too safe at home by yourself and you need a little extra care. So you'll have 24-hour nursing. You do have to qualify for a skilled nursing facility. We do go through your insurance, so that also has to be approved. And then we have to find you an open bed. Our case management here at the hospital can help work with you to do all that. Pre-admission process. So part of that is doing this class so that you feel prepped and ready and you know what to expect. The other part is pre-anesthesia clinic. We do call it PAC for short. It is like a doctor's appointment. The goal is to prevent any sort of complications. We don't want any surprises when you get to that OR, but we also want to optimize your health prior to surgery so that you're in the best shape possible to have good outcomes. Remember, it is a longer appointment. It's about 45 minutes to an hour. You'll go in, check in at the desk. They do height and weight. They'll do vital signs. They do labs. They'll swab your nose. They do an EKG usually, and then you go to a room. You stay in your clothes. A physician's assistant will come in and review your entire medical history. They kind of just go from head to toe through all your body systems, ask a bunch of questions, review the notes they've already received from maybe your primary care physician or any specialist that you see, and then they go over like your lab results. Again, it is a longer appointment, so please remember that. But then a nurse navigator will come in at the end. She'll have a bunch of information printed for you. She puts it in a folder. Part of that is your review of medications. So at the beginning of the appointment, they'll have you write down all of your medications. That includes vitamins and supplements, over-the-counter meds you might be taking, and prescription. They're going to list all of those out for you with your surgical date and tell you which ones to stop and which ones to keep taking. They can get confusing. Some of your blood pressure ones, they want the 24 hours before, but then some you can take morning up. I know Aleve and ibuprofen, Motrin, any of those kind of NSAID ones, you usually stop them 3 days prior. And then vitamins and supplements need to be stopped usually from 7 to 10 days, but occasionally they'll have you keep taking one. So again, it gets pretty confusing. Please look at that sheet as you are getting closer to surgery to ensure that you're doing your medicines correctly. If not, then please call that phone tree and press the number for PAC and just let them know. Occasionally, we do have to reschedule surgery due to a medication that you might have taken by accident. You can also write on this piece of paper the last date and time you took those meds. When you come in the morning of surgery, they are going to ask you for that information. And so you can just hand them that piece of paper with all the dates and times, and they'll be able to chart it from there. When you're waiting for the doctor at this appointment, you will be given this pre-surgery questionnaire. It looks exactly like this picture on the screen. It takes 2 minutes maybe. It's just little check marks. Part of it is data collection for the surgeon. They want to know over time. So we start with before surgery, and then we'll continue it at different intervals. I think it's 3, 6, and 9, and 12 months. They just want to know over long term the improvement in your pain and your function and kind of your quality of life if surgery was able to do that for you and how quickly. So please fill that out. It is very important for the surgeons to collect that data, and we really appreciate your help. During your pre-anesthesia clinic appointment, they are going to swab your nose for some pre-testing. This is going to let them know if you come back with staph or MRSA. Our skin is a protective barrier, and it carries good and bad bacteria. We all kind of colonize some of it. Just being out in public doesn't mean you're dirty or anything. It just means you picked up something. So 35% of the population could have staph or MRSA on their skin already. And so if that swab came back negative, you're going to do 3 showers total with the special soap. And on the next screen, I'll explain what to do if it came back positive. So in pre-anesthesia clinic, they're going to give you a bottle of the Hibiclens soap. It is kind of an over-the-counter soap, so if you happen to lose it, drop it, drive over it, whatever might happen, you can go to a local pharmacy and pick up some more, or if you're local, you can come back to the hospital and grab another bottle. It's exactly like the one on the screen, so they're going to give that to you, and you're going to do 3 showers with it. 2 days prior to surgery, 1 day prior to surgery, and the morning of surgery. So you're going to get into the shower those couple days before surgery, and you're going to wash your hair, your face, and your genitals with normal soap first, and then rinse those areas. You're never going to use the Hibiclens soap on face, hair, or your private parts. So wash that stuff first, rinse it. Then you're going to take the Hibiclens soap and you're going to put a big old squirt. You don't have to measure it necessarily, but just a big squirt. You're going to put it in either wet hands or a wet washcloth. It's very watery. It doesn't lather that well. And so don't put it into like a sponge or a loofah or it'll get lost. So wet hands or a wet washcloth, big squirt, kind of lather it the best you can. And you're going to actually wash the rest of your body. So again, not your hair, not your face, but your chest, your shoulders, your arms, your stomach, if you can reach your back, and your legs. Kind of get all those body parts, cover it in the soap, stand out of the water for maybe a minute or so, and then rinse it off. When you get out of the shower 2 days prior to surgery, you need to use a clean towel, clean clothes or pajamas, and clean bed sheets that night. Next shower, the day before surgery, do the exact same thing. Wash it all over your body, rinse it. You can use the same clean towel as long as you didn't drop it on the floor or an animal laid on it. Same clean clothes or pajamas, as long as no animals got all over you. And then same thing for your bed sheets, as long as no animals slept under the covers. It is okay to sleep with your partner. They don't need to be washing with any special soap, but just no animals under the covers. Morning of surgery, do one last shower, get in some clean clothes, and then come to the hospital. Once you start these showers with the Hibiclens soap, please do not shave your surgical armpit. So you can shave your face, you can shave your legs, just not that armpit on the surgical surgical arm. No lotion on your body the morning of surgery, except you can put lotion on your face. We're going to be putting leads on you to check your heart and lungs that need to be sticky, and lotion kind of hinders those from sticking. Also, no nail polish on that surgical arm. We like to check circulation, and it does help if you have no nails on, no nail polish or no fake nails. And then no deodorant on that surgical arm morning of surgery. So just, you can put deodorant on the other arm, but on your surgical arm, no deodorant. All right, here's the screen for if your swab came back and for positive for staph, MRSA, or both. Again, 35% of the population carry it, so there's no judgment on that you have a dirty house or you're dirty, nothing like that at all. We just want to decolonize as much of that staph and MRSA so it doesn't transfer to your new surgical site. You're going to be doing 5 days of showers, and they'll give you that little bottle of Hibiclens. Then they're going to order mouthwash and nasal ointment that will go to your pharmacy for you to pick up. It will come with very specific instructions on what to do, but you're going to do showers, mouthwash, and nasal ointment for 5 days. Nasal ointment and the mouthwash will end the night before surgery, so don't do that the morning of surgery, but you will still take 1 shower the morning of surgery. All patients morning of surgery will get another swab in their nose. This one's not to test, but it is the iodine swabs you see on the screen. It's just extra protection to ensure that no staph or MRSA that you might have picked up between PAC and surgery gets transferred to that new incision on your arm. All right, 1 business day prior to surgery, I will be calling you. If your surgery's on a Monday, I'll call you on a Friday. If your surgery's during the week, then I'll call you 1 business day prior. I usually start calling around 11 or noon when I get the times. I'm going to tell you 3 different times, so I do ask that you always have a paper and pen handy. I'm going to tell you when to check in, when to stop eating, when to stop drinking. The first surgery check-in can be 5:15 in the morning. You get really good parking, but that is early. But I just want to give you a heads up, someone's got to get it. So 5:15 could be the first time for your check-in. Eating is going to be 10 p.m. the night before you need to stop. So the day prior to surgery, eat like normal unless you've been told otherwise due to some swallowing issues. Lots of carbs, lots of protein for that kind of last meal. 10 p.m. stop eating. Water overnight as much as you want. You may have as much water as you want. If you're the type that gets up to use the restroom and you're thirsty, you can drink. If in PAC they discovered that you were diabetic or pre-diabetic, then you will continue to drink water until the cutoff time morning of surgery. It usually is about an hour before you arrive. If you are not diabetic or pre-diabetic, then they want you to drink water overnight, and then in the morning, right before that cutoff, they want you to guzzle down a 20-ounce sports drink with sugar. The sugar helps with post-op nausea and vomiting, and then just the hydration of all the 20 ounces will help with flushing out that anesthesia a little faster so you wake up less groggy. So I'm going to show you, I'm going to stop sharing my screen and show you the Gatorade or the Powerade that you can buy. Your job's to go buy it and have it in your fridge, and my job is to tell you when to guzzle it down. So this is a 20-ounce Gatorade. Just want to show you the size, and I want to show you the color. It is white. So it's not clear, it is whitish. This is 20 ounces Gatorade. Don't get the Gatorade Zero. This does have sugar. It's kind of a sweet tasting cherry, glacier cherry. If you can't find one of those by themselves, and that's okay, then you can always try a Powerade. This is the yellow. Some people kind of think it's like a greenish color, but this is yellow, lemon lime. It's kind of tart. This is 28 ounces, and so you can either just leave some at the bottom or you can drink it all. So Powerade if you want, yellow or white. Gatorade if you want, yellow or white. Just want to make sure that everyone's clear on exactly what to go buy. All right, overnight, please do not drink anything else other than the water, and do not get up and eat. We have people do that and they end up canceled. So please don't get up and eat. And then in the morning, you're only allowed that water or Gatorade, no coffee, no juices, no protein shakes, nothing like that. Just the water and the Gatorade. All right, what to bring to the hospital. So if you're here at our hospital, you are allowed to bring some personal items. So a phone, a wallet, a purse, a jacket, a book to read, an iPad, all of those are fine. We'll lock those up in a locker or keep it with your personal coach if you feel like that's okay. Insurance cards are usually looked at and copied into the chart at pre-anesthesia clinic, but if anything's changed, it is a good idea to bring those. You can have a copy of your advance directive in the system. It's also called like a living will or your 5 wishes. This allows us to know what you want if your heart were to stop before or after surgery. We always full code everyone in surgery. This is just good to have in your chart, period. Not trying to scare you for surgery, but if we're your local hospital, it's always a good idea to have a copy. We make a copy, put in the charts in there forever until you change it. We always give you back that original. Loose, comfortable clothing. So kind of think about what kind of surgery you're having and where. So usually a loose t-shirt or some sort of tank top is good. You are always going to put that first sleeve on your surgical arm and then over your head and then the good arm through. So again, something nice and loose is always nice or always easier. And then if you feel like you want something to kind of go over your shoulders, if it's going to be chilly, then something that zips or buttons up the front. So nothing that goes overhead, but something buttons or zips, you kind of just pull it over. You will be wearing that sling. So you'll put the t-shirt on first or the tank top, then the slings over that, and then you'll have the jacket that goes over your shoulders. Also wear comfortable pants, loose fitting pants, because you're only going to have one arm to pull those up. Slip-on shoes are going to be helpful because it's hard to tie with just one hand. And so moccasin type slippers with a rubber sole are good. Any sort of tennis shoe that you change out the laces into elastic shoelaces, those are always good as well. Just kind of think about it ahead of time. I know Skechers sells a lot of slip-on shoes. No flip-flops because you just kind of fall out of those. No Crocs either because you tend to slide out of those as well. Toiletries, if you plan on spending the night, we do have toiletries like a motel would have, just little travel sized items. If you know you're spending the night and you'd like your own items, absolutely bring a little toiletry bag. If you wear glasses or hearing aids, please bring those because we want to see and hear everything that we're teaching you, but we also will be very careful with them. We label them, put them in a bag, and it stays on your bed the entire process. CPAP machine. If you wear CPAP at night or maybe a BiPAP, we want your machine with your settings to protect your airway while you recover and anytime you're sleeping. So please bring the machine. We provide the distilled water and we have oxygen every room. So if you have an oxygen concentrator that you bleed into your CPAP machine, we do have the oxygen. So just bring your CPAP machine and the mask. If you're on medications that you use every single day and they're multi-use, like you open the bottle and they last a month, please bring those. So those usually include eye drops, nasal sprays, and inhalers. When I start calling you the day prior to surgery with your times, a pharmacist is also going to be calling you to go over your med list one last time, and they will tell you if you are on something that we do not carry here at the hospital, they'll tell you to bring it in. Otherwise, please do not bring all your medications from home. We are not legally able to use your medicines. We have to use ours if we carry it. Please don't bring anything sentimental, valuable. We don't want to be responsible for losing it. And then no jewelry. So please remove all your jewelry. If you have rings that are just absolutely stuck and there's no way you can get them off, maybe your knuckles have gotten big from arthritis or you've gained a little weight since you got married, a couple decades ago, then just know that we will cut your ring if your fingers swell too much and your finger starts turning purple. We are going to save your finger and then cut your ring. But try to get them off if you can. All right, day of surgery. This is also where you can check in for pre-anesthesia clinic. It's going to be entrance 8 at the back of the hospital. So either go on that Ellis Street and around, or you can go Highland Boulevard to Old Highland Boulevard and go around. Usually park in lot F, go into that 8 entrance that you see here on the screen. There's double doors. When you walk straight ahead, there are elevators. You're going to go up to 2nd floor. When you come off the elevator, you're in this big waiting area. If you need to go to pre-anesthesia clinic for your appointment, pre-surgery, then you'll go in this little door here that's labeled. Day of surgery and you need to check in, you're going to check in at this big brown desk. Again, you come off the elevator and it's right there in front of you. There is a human sitting there at 5 in the morning, so you are greeted by them and not just a computer screen, which is really nice. This is also the waiting area for your personal coach, so they can sit around and wait and look on the screen with the little colored stripes. It'll say where you are in the process, such as starting procedure, in process, closing, moving to recovery, waking up, those kind of information. If they'd like to leave and come back in a couple hours, maybe they want to let the dogs out or go get lunch or run an errand, they can ask for procedure update text messages. So same information on the TV screen will go to their cell phone. That day when the peri-op nurse asks, then just provide that person's cell phone number. All right, day of surgery. So you do get called back from that waiting area. They go back into a peri-op room. They're going to do your weight one more time in case it changed. They're going to give you a HIPAA-Cleanse cloth that you're going to wash your shoulder area with. You get into a gown. They do your vital signs, start an IV. They'll swab your nose again with that iodine nose swab. And then the surgeon will come in and visit you and answer any questions. So make sure you have your questions ready because it's the only time you see the surgeon before you go into surgery. And then your anesthesiologist will also come in and kind of review the plan for the day. Great time to ask them questions as well. You are going to be under general anesthesia. So this does provide anesthesia for the entire body, so you're completely asleep. You do have the tube down your mouth, so you are intubated. You also get a nerve block before surgery, which will help with pain after surgery for about 24 hours, sometimes 36 to 48 on some people. This is just a temporary numbing, kind of a blocking of that nerve bundle up in the shoulder to help with pain. It goes kind of up in your clavicle area. They'll give you some medicine to make you a little sleepy, start the oxygen, and then they do the injection by ultrasound. Again, it can last up to a couple days, but we find usually by 24 hours it starts to wear off. So we always start you on some sort of oral pain medication to stay ahead of your pain, not get back behind it, and we're trying to play catch up. Operation and recovery timeline. So the different stages are pre-op, surgery, and recovery room. Pre-op is 2.5 hours. You may go back a little early, but usually it's about 2.5 hours. It's kind of a hurry up and wait. That first hour is a little chaotic as they get you ready. Second hour is kind of just laying there. There is a TV in the room. There are a chair, at least one chair, sometimes 2 chairs in each room where your personal coach can come back with you and just offer some moral support and company before you head back to the OR. Surgery is about 1.5 hours. Recovery room is going to be another hour or two. This is the PACU. This is where they start waking you up. They take the tube out of your mouth, might give you some ice chips, get you off oxygen. Once you're ready and really awake and talking, if you're going home same day, so if you discussed with your surgeon that you may try and go home same day, you'll go back to a peri-op room and recover, see physical therapy and occupational therapy, and then you're cleared to go home. If your surgeon recommends you spend the night in the hospital, you'll be transferred to a room on our orthopedic unit called the Spine and Joint Institute. This is going to be entrance 1, Bridger elevators to 3rd floor. So if you get into your room number and you call your family and they say, oh, you're settled, you're awake, we want to see you, we're going to bring you some flowers and dinner, then they need to park at entrance 1, take the Bridger elevators and go to 3rd floor, and then they'll find your room. After surgery, you're going to get up and move around. We want to circulate that blood in your legs. We want you to stand up tall so you're taking those big, deep breaths so you don't get pneumonia. You also want your bowel function to come back sooner. And so you're going to get up and move around in your room. It might just be to the bathroom that night. Next day, though, we expect you to kind of walk around that hallway. You can be up in the room as needed once we know that you're not dizzy or lightheaded. You're going to walk in the hallway at least twice a day. So usually, again, that evening and then the next morning, or if you end up staying for most of the day, you'll walk twice. And then eat all your meals in the chair, again, just to get up and sitting, and you're sitting up straight so you can take those big deep breaths. Pain management. So you are going to have some pain. It is a major surgery. That's why we give you that block for that first day to kind of help you out. But the better your pain is managed, the better your recovery. So we do the 0 to 10 scale. It is shown in every room. 0 is no pain at all. 10 is the worst pain you've ever imagined. So we kind of expect you to be, goal of like either 0 if your block's still working, or maybe like a 3 or a 4. It's kind of annoying. It's hurting a little, but it's not terrible. The better your pain management, then the better you're doing your recovery because you're participating with physical therapy, you're getting up and moving around. And so we do take a multimodal pain approach to that. That means multiple methods to help with that pain relief. We do a lot of icing. We're actually going to give you a free ice wrap. It's kind of just like a little gel ice pack. You get 4 of them, 2 go in the freezer, 2 go in your pack. And then the ice wrap is really nice. It goes on your shoulder, kind of hangs on both sides, little strap that goes around under your armpit to connect to the back. Then the bigger strap goes around your chest and keeps it on. So when you bend over and stuff, it doesn't fall off. So we will be providing that for free. We start it right after surgery so that you have ice on. Occupational therapy will come around and kind of show you what movements you can do, and they'll give you some exercises for your wrist and hands to get some of that swelling out. And then we always give you high doses of Tylenol if you're able to take Tylenol. Usually it's 1,000 milligrams 3 times a day. If you take it consistently at that high dose, it does help with pain. We do anti-inflammatories also as like Celebrex, muscle relaxers. Sometimes your shoulder's kind of in a new place, your chest and back muscles are kind of thinking, what's this new alignment? And so then they start kind of getting stiff and cramping. We also have nerve pain medications just in case you have any shooting nerve pain down your arm. We use mostly narcotics and opioids for that pain control. Some of those side effects that you could get is constipation, nausea, and vomiting, drowsiness, and itching. We have different options, different meds that we typically give, and so we can always try a new one if you're feeling sick. We also have medicine to help combat some of those side effects. Preventing complications. So one of them is a blood clot. Again, you're going to be up and moving quite a bit because it is your arm that's had surgery on, not your legs. So we usually typically our shoulder patients do well getting up, but we want to put you on a anticoagulant medication for 35 days to thin your blood just in case. It's usually a full aspirin, 325 milligrams. If you're not allowed to take aspirin or you're already on something for a heart murmur, you'll go back on that medicine. We do give you a medication tracker. It's nice. It's a little pamphlet thing that's got a list, and it's got little squares for 35 days. So you can put the dates, and then you know that you've taken it for the entire amount of time. We will give you 2 magnets along with this tracker, and you can put it up on your refrigerator. You're going to wear those compression stockings to help with that circulation. You're also going to get up and move around. And then when you're sitting around, you can always do just foot pumps by pumping your feet. Infection prevention, you as a patient, you're going to wash with that special soap we discussed earlier, and that will help prevent any sort of infection. Good hand washing. So when you get home and you are dealing with germs from the public, maybe friends are visiting, families coming and going, doing errands for you, everyone in the household does need to do good hand washing so that you don't get another illness on top of trying to recover from surgery. Continue good oral care. So again, nothing goes wrong in your mouth where it can transfer into your shoulder hardware. deep breathing exercises in the hospital. You will be given an incentive spirometer. It's a little machine where you suck in the straw, makes the little ball go up, and you kind of have to hover it to hold that breath and let it out. We will send that home with you. Use it for a week or two, then please throw it away because you cannot clean them. Everyone gets preventative IV antibiotics. You get it before surgery, after surgery for a couple doses, before you go home. Goes straight to your bloodstream, and it is a very good preventative measure for any sort of infection from starting. Constipation is always a big complication from all those narcotics that you're going to start taking. Drink lots and lots of fluids. We recommend half your body weight in ounces. So if you're 200 pounds, you got to drink 100 ounces of water every day. I kind of think most of us are dehydrated at baseline, and so try and drink as much fluid as you can. High fiber foods will help. After surgery, we're going to start you immediately on stool softeners. It's all over the counter items. So if you have something at home that works for you and it's a great trick, then you can use that. Orthopedic magazines and research show that warm prune juice will also help and is a good natural remedy compared to those over-the-counter stool softeners. Discharge from the hospital. So again, this is if you ended up spending the night. Please arrange a ride home for kind of late morning. You do have to meet criteria. So your vitals are stable. You're not lightheaded, dizzy, blood pressure's good, heart rate's good. You're not have a fever or feeling funny. Eating and drinking with no nausea. So by this time you've had dinner, you've also had breakfast. And we know that you're going to go home and be able to eat and drink without any nausea or vomiting. You're passing gas, so you won't have a bowel movement most likely, but you are passing gas. We can hear bowel sounds. Your gut wants to work. You're also urinating and emptying your bladder. You do not get a Foley catheter in your bladder during surgery. So we just have you go before surgery and then when you need to after surgery. But we want to make sure that you're emptying your bladder. So sometimes we do a little bladder scan on your stomach just to make sure that your bladder is empty. Pain's controlled with oral pain medication, so nothing through your IV. You're out of bed and therapy believes that you're safe enough to go home. Discharge instructions are provided by a discharge nurse. That is their job. They go around and discharge patients, so please be patient with them. They're trying to kind of juggle anywhere from 5 patients to 15 or 16 other patients. They will print everything off, put it in a nice little folder. We do ask that your personal coach there is listening because you as a patient are going to be over it by this time. You're just ready for your own bed and your own couch and your own house. And we absolutely understand that. Probably a little tired as well. And so we do want them listening. Then you have paperwork to reference once you get home. Prescriptions, you are going to receive several prescriptions. We do this in order for your insurance to cover maybe over those over-the-counter medicines. So you're going to be sent home with a narcotic or that opioid for pain. You're going to be sent home with that anticoagulant. Again, it just could be an aspirin, 325 milligram, stool softeners, and then a medicine to protect your stomach because you're taking aspirin. It's usually Prilosec. Again, most of those are over the counter except for the narcotics. And we're going to give you prescriptions to try to have your insurance cover it. There's 2 ways that you can get your prescriptions here at the hospital. One, we can send them through the internet to your local pharmacy, and then you can pick up your meds on the way home. If you'd rather have them here at the hospital where it's a little more convenient, or maybe you live out of town and you feel safer just getting your meds now and then going straight home, it's called Med to Bed, where we send them down to Highland Park here at the hospital. You pay over the phone if you owe anything after insurance, like maybe a copay. And then the medicines are delivered to your hospital room in a little baggie. That way you have them and then you just go straight home. They'll come around and ask you which you prefer. Recovering at home. So please don't mix any narcotics with driving, alcohol, or drugs. We do have to say it because people have done it. Use your incentive spirometer about 10 times an hour for that deep breathing. Don't get lightheaded, break it up a little bit, maybe set a timer, do it when there's commercials on TV, but definitely try when you're awake about 10 times an hour. Take short, frequent walks during the day when you're awake. We just don't want you getting stiff. We want to circulate that blood in your legs. So just get up and kind of walk around. You're going to want to sleep semi-reclined with a pillow resting under your surgical arm. A lot of our patients find the recliner is the best place to sleep for a little while. You can stack some pillows underneath your upper body and kind of get your head semi-reclined, and that will help with the surgical arm just resting in front of you. Again, ice as much as you want. That will help with pain relief and some swelling. We will give you that specific wrap I showed you earlier, the 4 ice packs and then the wrap all go home with you for free. Your surgeon's office might offer you to rent or buy an ice machine. There's Iceman and a Kodiak, depending on your surgeon. Those are plugged into the wall. You do fill up the reservoir with either ice or frozen water bottles and then water. It is cool water that will circulate through a wrap. We just ask that you don't ice during the night when you're asleep because you always want to protect that skin area from freezer burn. Wound care is going to be super easy. You're going to have a wound dressing, this little silver one. It's kind of a gel Band-Aid type, goes over your incision area. You try to keep it as dry as possible. If it gets wet or you have drainage coming out, we do give you extra to put on, but you keep it on usually for 7 to 10 days, depending on your surgeon, and then you take it off and it's open to air. It won't completely heal. Your skin won't completely shut together for about 3 weeks, sometimes 4. And so we do ask that you don't put any oils, ointments, or lotions on that area because we want it to heal without any bacteria getting in there, and then you create like an infection in a pus pocket under the incision as it's healing. And then we have to open you back up and take you back to surgery. So no soaking. You can take quick showers. Again, that dressing is water resistant. It's not quite waterproof, but it is water resistant. So if you have the shower stream on the opposite side and maybe just some water speckles on it, that's okay. Just don't have it pouring on that shoulder. So no soaking in pools, hot tubs, hot springs, or the bathtub. All right, I'm going to pass it on to Ellie, who's going to be our occupational therapist and go over their job.
Hi everyone, I'm Ellie. I am part of the occupational therapy team here at Bozeman Health. In the hospital after surgery, you will see an occupational therapist. They are typically wearing a teal scrub top like the one I have in the video here. We help assess and help you plan for a seamless discharge process in order to optimize your safety and independence with participation in ADL, so activities of daily living, anything you really have to do in a day to be successful: dressing, bathing, showering, using the toilet. We help you determine any equipment needs you might need going home for your independence with all of these activities. So you'll often hear us recommend DME, which stands for durable medical equipment. You can get this prior to your surgery and start practicing at home using all of the items. It can be helpful to take a picture of your bathroom prior to having surgery, and then you bring that in and show your therapist, and we can help problem solve any unique bathroom setups you might have. Some key points to remember, and you will get a handout of all of this when you're in the hospital. Depending on what your surgeon sees during your operation, they will make a recommendation on how often they want you to wear your sling. We will indicate on your handout how often your surgeon would like you to wear your sling. Typically, Dr. Vinglas has his patients wear them as needed for comfort. I tend to recommend, if it's your dominant arm you had surgery on, I tend to be a little more conservative and tell people to wear it most of the time when you discharge home, just to make sure you aren't accidentally using that arm for any of your ADLs. You will want to remove your sling each day to wash your arm. And if your surgeon prescribes exercises for you to do when you leave the hospital right away, we will make sure we go through all of those with you. We will also indicate what sort of activities you are able to do after surgery, post-op day 1 when you leave the hospital. Sometimes your surgeon doesn't want you doing any exercises. Sometimes they will have you doing pendulums and elbow, wrist, and hand motions. Again, this is something we will go through in specific with you after your surgery. And so a lot of times your surgeon doesn't know what kind of restrictions they would like to give you until after your surgery is completed. So stay tuned for your any specific exercises they're going to have you do. Some key points to remember: no weight bearing through that surgical arm. This is standard across the board for any shoulder replacement. This includes leaning on your surgery arm to stabilize standing at the kitchen sink or in the bathroom. You do not want to push through your elbow if you're trying to scoot up in bed or back in a chair. No carrying items with your surgery arm if it's greater than 2 pounds. So you can carry your phone or a light water bottle across the room, nothing heavier than like a heavy milk jug. You may use your hand or your surgical arm for functional tasks such as eating, typing, and writing. Especially if this is your dominant arm, you will most likely be wanting to use that arm to eat unless you have somehow practiced your left arm and have managed to modify some of those activities using your non-dominant arm. Your surgery arm should not go behind you, so pulling up pants, wiping after toileting, or washing your hair. Your arm should stay tucked to your side. You should be able to see your elbow at all times, so you can straighten your arm to your side or bend your arm up, but we really want you to keep that elbow close to your side. Typically, the surgeon will have you do range of motion at your elbow, wrist, and hands. We will give you a handout for all of this and review this with you before you discharge. Again, bathing and showering, you'll remove your sling each day to wash your arm and shoulder. We do not want you soaking that incision in bath or hot tub. Generally, across the board, we recommend a shower chair or a tub bench. This will depend on what sort of setup you have. If you have just a standard walk-in shower, we'll recommend just a shower chair, standard shower chair or a shower stool. A tub bench is something we recommend for a tub shower combination. This will help you position your arm out on your leg so that you're able to reach under your surgery arm without having to lift your arm up over your head. We encourage you to sit down while completing upper and lower body dressing. This just reduces your risk of fall, getting off balance, and having to put weight through that arm. Wear loose fitting clothes. I generally tell people to do a large, stretchy t-shirt. Usually a couple sizes bigger than what you normally wear should be good. Elastic waist pants and loose fitting pants are easier to manage than things that are tight around the ankle, like joggers or leggings. Generally, Costco has a great selection of things that I recommend people wear post-surgery. If you're going to do a front opening shirt, I would do something with snaps rather than buttons. For dressing, the easiest way to do this is put your surgical or least mobile arm in your shirt first, followed by your head and then your non-surgery arm. I always recommend people practice this prior to coming in for your surgery with avoiding that, bringing that surgery arm over your head. Arrange your house so frequently used items are easily accessible. Have a family member or a friend place items on countertop height so you aren't having to do any bending or any activity that puts you at risk of falling. Keep your living area and walkways free of clutter and well lit. Put away throw rugs for at least 4 weeks. Sleeping on your back with your surgery arm supported in the sling and propped with pillows is recommended. I always tell people you don't want to prop your arm up this high, but just kind of put a pillow right under your arm in the sling and maybe have one put right behind your elbow just to keep it from sneaking behind you. Some people find a recliner the most helpful, but it's not necessary to have. Resume to driving is going to be up to your surgeon. A lot of it depends on if you're taking any narcotics for pain. And then depending on what arm you have had surgery on, some surgeons are okay with you getting back to doing one-handed driving, and that will be up to your surgeon's discretion. Plan to have somebody transport you to appointments, grocery store, etc. This is our durable medical equipment slide. So this is a standard raised toilet seat. This is a locked raised toilet seat. So this one has armrests. Both of these toilet seat options have a tension-based system when you mount it on top. I always tell people if you're going to use the armrests on these, just make sure you kind of test and wiggle the seat to make sure it's on there sturdy. This is just a safety frame. These go into the bolts of the back of the toilet. If you already have a taller toilet, these are a nice option just to have an extra handhold. This is a bedside commode. I only really offer or recommend these to people for a temporary option, removing the bucket and then placing it over your toilet, especially if it's a lower toilet, and then you can raise up the legs and adjust it to your height. These are also great because they have these armrests here. I will often recommend these over the raised toilet seats because the bedside commode is quite a bit easier to clean. Again, this is the bathtub transfer bench. This is what you will want to use if you have a tub shower combination setup. This is a standard shower chair that we recommend for walk-in showers. And then this tiny picture here, you can't see it very well, but it's just a standard shower stool. These are grab bars. We always recommend the bolted grab bars over the suction cup grab bars for safety. So if you have somebody handy in your life that can help you bolt in some grab bars, that is always recommended and a safe option. These are just some one-handed techniques for dressing. We kind of already went through this, but it just shows you how to dress your surgery arm first, bring it over your head and around your back, and threading your non-surgery arm. Again, we will show you how to do this in detail when you are in the hospital. Again, putting on a button-up shirt, I recommend snaps instead of buttons. One-handed dressing for putting on socks and shoes. We tend to recommend putting or using slip-on shoes. A lot of people have bought the slip-on Skechers shoes with the kind of built-in shoe horn in the heel. Then you're not having to bend over as much. We want to avoid things like flip-flops or loose shoes that are going to flop off your feet when you're walking. Just some tips for personal care and managing in the kitchen. So these are things like Pop Top toothpaste, how to don deodorant, using clips if you have long hair. So we usually have these in the packet prior to surgery so you can have some time to read through these and pick items up prior to surgery. Again, just some more tips for daily activities. These are the exercises that you will likely be prescribed after surgery. This first exercise is the side-to-side pendulums. The second one is front to back pendulums. And you will repeat these 20 repetitions 3 to 5 times a day. The tip with these pendulums, you'll lean over and put your non-surgery arm on a sturdy surface, and you'll hinge forward at the hips, letting that surgery arm just hang. And then you will let gravity do the work while you move your whole body side to side or front to back. Again, you'll have opportunity to practice these. And then the last pendulum is circular, so we'll do clockwise and counterclockwise. Scapular retraction and bicep curls. You will likely have a block prior to your surgery, and this will affect your ability to move your arm initially for the first 1 to 2 days after. We will show you how to do some of these activities if you don't quite have full movement of that arm. Wrist circles, strength building, and then open and closed fist. These have all of the repetitions we recommend and how many times per day you will complete them. Thank you for joining, and I will pass this back over to Emily for any further questions.
Thank you so much for joining today. We appreciate it. If you have any questions, just contact us. Thank you.